we get started. So we can forward it and make it available to others if they want to see it, if you want to pass it along. We are excited to have Kim present on the innovative work being done at the United Way of Western Connecticut's new nonprofit subsidiary, the Prosperity Digital Marketplace. She will be sharing insights garnered from focusing on households that live paycheck to paycheck and offer a glimpse of the technology platform being built to better serve the ALICE population. Just a little bit about Kim. I'm personally really happy to have her. We're trying to get this going for a couple of months, and then this COVID thing happened, so we're really appreciative to have you, Kim. Kim Morgan is the CEO of Prosperity Digital Marketplace, LLC, and United Way of Western Connecticut. With more than 30 years of experience in the nonprofit field, she has worked to improve the quality of life for those impacted by poverty, mental health, and substance abuse issues, and homelessness. Kim has consulted with nonprofits on outcome measurements, strategic planning, nonprofit startups, and grant writing. She helped lead efforts to win a competitive Boston Federal Reserve Working Cities Challenge and a Bloomberg Cities Challenge Award. Over the past several years, Kim has transformed the business model for United Way of Western Connecticut to focus on delivering services to households that live paycheck to paycheck. ALICE, the ALICE population, which of course is asset limited, income constrained, employed, and using collective impact to make systematic change in educational ecosystems. Today, she serves as CEO of the Prosperity Digital Marketplace, LLC, a nonprofit subsidiary of United Way of Western Connecticut, using technology to improve access to services for ALICE households and enable businesses and individuals to connect to those in need. Kim has served on multiple boards and currently serves on the board of the United Way of Connecticut and on Regional Advisory Council of Naugatuck Community College. She holds an undergraduate degree in psychology and an MS degree in management communications. She has been with the United Way of Western Connecticut for the past 15 years. Kim is a native and current resident of New Fairfield, Connecticut. She and her husband have 3 daughters, and they serve as licensed foster adoptive parents for DCF for over the past 10 years. So that's a bit about Kim. We really appreciate you being here, Kim, and I will hand it over to you. So thank you for being here.
Yeah. Thank you so much, and it's great to see many of you because I know the majority of people on the call today, and it's nice to actually see your faces. It's been a long 2 months. And I'm thrilled to have, especially Lana, and we have Anka on, I think, because we've been working with them on our emergency fund. And some of the work that we're doing is enabled us to jump into that fund quickly and use technology to deliver it. So thank you. I'm going to share my screen. I am getting little notifications popping up that my internet is not stable. So if you see Marjorie going like this or signaling to me, it means that I've frozen and I will hopefully rejoin you. Let me share my screen. So many of you on the call do know about the ALICE population. And so I will walk quickly through some of the work that we've been doing as a result and where the direction that we're heading in. And then I'd love to just open it up for conversation. Feel free to stop me at any point. Somebody has a question. I think the chat is open as well, and somebody's monitoring that. So let's see. So we really believe that it's time to change the fact that pre-COVID, 40% of Americans who are working can't afford life's basic necessities. We know that post-COVID, and I'll talk a little bit about that as well, is going to change how this looks. ALICE is an acronym, for those that don't know, that stands for Asset Limited, Income Constrained, and Employed. So it is those workers who typically are low wage, but may not be. If you have a single mom and she has 3 children and she's making $20 an hour, she would fall into the ALICE category. And today I'll talk a little bit about how we went out and listened to ALICE, some of our responses, the future, and then how do we engage businesses in a new way to support this population. So in 2015, we had the ALICE report, as many of you know, in Connecticut. It's now in, I believe, 21 states. Connecticut was in the second cohort after Northern New Jersey started. And I thought it would be just some nice data to share with folks. And it turned out to be something that changed our entire organization. We went out and listened to ALICE directly. And some of our partners on the call today actually were generous enough to introduce us to the clients that they served. And then we also went out to groups that may not end up showing up at the doorsteps of a social service agency, as well as seniors. We did 27 community conversations in a year. We did 520 surveys, and then we created individual interviews and feedback loops. And today, we have a ALICE Advisory Council where we pay ALICE participant or ALICE individuals with lived experience who are currently living paycheck to paycheck to sit with us every single month and advise us to test everything that we're doing, so that we make sure that we're not moving in a direction that we might think is right and it isn't a good fit for them. And I'm always surprised by what I learn and the assumptions that I make that I shouldn't make after you actually talk to people with that lived experience. The challenge with ALICE, of course, is that they don't qualify often for government safety net programs. They're typically just above the poverty line. They may fall in and out of being qualified for Care for Kids or for SNAP food stamps, but typically will not be eligible for housing. And there's no platform that exists today to really effectively deliver support to them. So when we went out and listened to ALICE, we realized that there were a number of areas that were not being met in the current social service system, either because the programs didn't exist or the infrastructure or the system wasn't there. And so we started to explore different ways to serve them. I'm just going to talk about 3 or 4 programs that we've launched since starting ALICE and then lead into what that's heading to for us in the future. So we started an ALICE Enrichment Fund because when we did community conversations for elementary and middle school around education, and I thought that the biggest need was going to be after school care, what rose to the top was actually that families did not have the money to pay for enrichment activities and that their children were being left behind. They weren't exposed to the arts as much. They weren't in sports often because now it's a lot of pay for play for pay, and music as well. They wouldn't be able to afford the instruments or you know, other pieces of the lessons if they were really talented. And so we did some research. We found out how much enrichment activities benefit children in the long term and have an economic impact on them, because not only because they might learn a skill and the lessons about being on a team, but because they network with more affluent peers. And we know that networking and relationships are critical to future economic success. So we started an enrichment fund where we would fund music, sports, and arts for ALICE, and it was intended to help supplement, not necessarily cover the entire cost. We said that they had to fit the ALICE income threshold. It had to be an approved activity. The cap was $300 per child per year with a cap of basically $900 per family if they had 3 children or more. We started out with partners, and that's how we've been running the program since. And every community that we work in, I think we have 10 different partners serving 15 towns and cities, has had a different type of partner. So it might be Department of Social Services in some towns and cities. It might be a youth agency. It might be a volunteer program. It really depended on who was there and who was able to take the program on. And the traditional model that we've been using is that we identify the partner organization, send them a grant. We pay an administrative fee for them to administer it. I will say that the administrative fee does not cover the cost of what that organization is stepping up and doing, because what we found is that when ALICE households come in to be determined eligible, they're finding a friendly voice and a person that cares, and they may not be connected in any other way to social services, and they will take up more time with that caseworker than simply filling out an application for the enrichment fund. The partner follows their verification process, works with the folks, whether it's a client or not. We get a report every 6 months, and then we compile different stories and data and forward it on to our donors to raise more money for the fund. This is a challenging model because Alice has to take time off of work, typically physically go in, although that's certainly changed today, to go in and apply, go through whatever process that nonprofit has in place to do income verification. And then what happens is the partner cuts a check to the organization. And one of the challenges is that, let's say you're signing your child up for basketball, the basketball coach is often the father of one of your child's friends, right? And so there's an exposure to the fact that they are using charitable needs to sign their child up. So the new model that we are now looking on is with, and I'll talk a little further when we get into the marketplace, is an online income verification process with a secure vendor. We approve the activity and the participant receives a locked Visa, which is, or locked MasterCard product, which is what we're testing today with our COVID-19 fund response. The participant then pays the vendor, the art class, the basketball league, the music lesson, so that nobody knows that it's charity. And then we're able to communicate in real time because we know as the families are signing up, we can send out notifications to our donors and encourage them to give again. To date, and this was done, these numbers were pulled probably in November or December, so it's a little higher. We had 820 children benefited from the program, 983 activities, and about $190,000 has been distributed into those activities. Of course, a lot of that is paused now with the COVID-19 crisis, and we hope to resume that as soon as it's safe to do so. Another thing that we heard from Alice is that they did not have assets. They didn't have savings, emergency savings. Most of you probably are familiar with the statistic that 47% of households do not have enough savings over $400 should an emergency happen. And we were funding and have continued to fund on the ground traditional budget coaching. But again, we realized that with Alice working, that's not always, she's not always able to take time off of work to go do budget coaching when it's available. And so we felt that we needed a digital answer to that. So we found a program called Save Her Life, which does a matching savings program. We matched that with Trust Plus, which used to be called, it's a neighborhood trust program. And we created a program statewide with the other United Ways called Alice Saves. This savings program links individuals' bank accounts to Save Her Life. If they put aside $20 a month, they get a match of $10 a month. And then they can earn up to $60 for the first 6 months. And what's really interesting is the data that we get shows that once people get into the habit of saving just that little bit, that it continues and they actually save more than what they originally were required. You do need an online bank, but any bank works with it today, and you need an email address. One of the challenges with this program is there is no income limit. So we have not been able to limit it, but we know from most of the data and where we're targeting that the majority are Alice that are participating. So the person signs up, they connect, they save, and they keep saving. Trust Plus is a program that we're actually launching again today statewide. It is a financial coach online, and this program has both English and Spanish speaking coaches. It is used, you text, you Skype or Zoom or FaceTime, and you make appointments when it's convenient for you. I believe they also have time on the weekends to meet with clients. And it basically gives everybody access to a financial coach. And they've reduced client debt by 4 million since 2016 nationwide, We have chosen partners that are national in scope, so that we're able to leverage our funding with funding that they get from national funders. And the way Trust Plus works, and because of the COVID-19 crisis, what we've done is originally you had to start doing the matching savings in order to access that coach, but now the coach will be available to anybody in the state through the United Way partnership directly. And so the client texts the program, they receive a welcome message, and then they set up their first counseling session. And counseling sessions can be once, they can go up to 4 or 5 times. It depends really on what the person needs. And since the last year and a half that we launched this program statewide, we've had 319 go on to savings. Again, these numbers are from probably November, December when we did the presentation first. 60% of people who used the program reported they were now regular savers, compared to the pre-survey that said 15% were, and 77% said they were living within their means, compared to only 57%. And we're able to get really good data. They do pre-surveys, post-surveys, and then they measure because they are able to see how much money goes in and out of your savings account. They're able to measure a lot of data for us. The next program I'm really excited about, we piloted it about a year ago. You know, we have traditionally worked with food pantries. We have several food collaboratives. We have one in Danbury, one in Stamford, helping pantries to really coordinate services, share resources, etc. But we really felt like we needed to figure out a way to get people shopping in the grocery store whenever possible. That mobile food pantries and the food pantry services are phenomenal, and you can see today the need and that infrastructure and the way to get mass amounts of food out. It can't be beat except through the pantry system. But we really feel like people need choice and dignity, and lining up for food in a parking lot or outside an office and being handed something. And we know that all our partners don't just bag everything, although today is a little different because of the health concerns, but that they need choice. They need to choose foods that fit their family's lifestyle, nutrition needs, etc. So we found a program called Healthy Savings. We've piloted it for almost a year now, where people save on produce. In addition to produce, so we match produce dollars. We pay up to $10 a week if they spend 20 on produce. So if they spent $14 on produce, they get $7. It comes off your bill right when you get to the register. So it's literally money coming off your grocery bill. And then they partner with all of these are a sampling of the branded savings, and they deliver coupons every week on top of whatever your store coupons might be. And so this is an example of one of the times that I made an assumption and had to be corrected by my advisory group. There's a lot of food products that come through that are not, they're organic, they're almond milk, you know, they're high-end products a lot of times. And I said, you know, people can't afford food. Why do they need coupons for almond milk? And the advisory board told me, well, I have children that have food allergies, or I have an autoimmune disorder and I need to be careful of what I eat, or I'm gluten-free. And so this has given them an ability to afford the foods that they really need. The way it works is you get a card or an app on your phone. It delivers the coupons right through the app. You scan it at the point of sale, just like you would your grocery store card, and the money comes off your bill. And it's integrated in our footprint in Connecticut into Stop and Shop, Acme, and Walmart right now. And we've been working hard to get ShopRite on board, but it's a national brand issue. It's not just your local stores that has to be integrated. We have over 500 people saving and benefiting from this program today. And we're working as well with Stamford Hospital and Danbury Hospital, giving out cards to people who are in their clinics. Danbury started last summer. Stamford is hopefully going to come on board soon with some of their patients, and then we're starting to measure whether that has implications for the health as well as just the savings piece. And I know that some of the partners on the call, feel free to jump in when I pause in a minute, because I know that we've been using the program in particular in our response to COVID-19 in Stanford today. So we've been signing more people up. We flipped a switch on it. Instead of a match, we made it into a $20 benefit per week, and we're going to do that through the end of June. So we signed more people up, we changed the offering, and we're able to do that pretty quickly in response to the crisis. And then finally, I'll give a highlight on the Giving Fund, which is a program that we partner with the News Times on in the Danbury region. And I know that agencies like Family Centers partners in Stanford, and the United Way of Coastal Fairfield County partners with in Bridgeport. And we basically identify cases that we put in paper from agencies, and then people basically adopt a case and send payment and fund, it might be a rent payment, a utility payment, holiday gifts, whatever it might be that the family needs. The stories are heartbreaking. I mean, really, truly, the frontline workers who are helping families manage day to day, it's just incredible. And this program raises more money faster than anything else because it pulls on the heartstrings. But the challenge is you're picking and choosing families, right? And you're not exposing them in any way because you're not using their names or anything, but it's kind of a clunky way to support people. Write a check, mail it in, read it in the paper. And so this is one of the programs that we're hoping to also bring online with the new program that we're focused on. So when we pulled all these programs together, we realized we needed to raise money for the future of this effort and to start doing our work differently. We launched a quiet phase of a campaign that we will probably be going public with in January, and started to raise money specifically for these new programs. And some of them were not launched at the time we started this campaign, and the dollars that we've raised, we've been able to launch. So for example, Healthy Savings and a lot of our food work came out of this campaign. But we realized that we could create all these programs, but the system and the way to deliver it is still difficult. And I think we've seen from the COVID-19 crisis that having people pre-qualified in advance and having an income verification that goes beyond what the state does or the federal government does to really include those households that are struggling and living paycheck to paycheck, but won't qualify for SNAP or for housing because their income's too high, that there's really a gap there. And so we formed a nonprofit subsidiary in November. We called it the Prosperity Digital Marketplace. And I've kind of peeled off from the day-to-day United Way work to really get this up and running and make sure that we have the resources that we need to scale this nationally. So our solution is that we've got, for example, I showed you very quickly in the beginning, the Gilbert family. And they are dealing with increased stress, debt. They have less time with the family because of the jobs that they're working. And their work productivity, quite honestly, is not as good as it could be, because when you are stressed and you come to work and you haven't either you haven't fed your family well, or you're worried about your bills, you are not fully productive. And all the programs that we put into place address these concerns. But how do we find the Gilbert family? How do we communicate with them? Alice is working in thousands of small and mid-sized businesses. They're not organized, and there's no mass way to communicate. So we're going to be developing a digital community platform where you will do an income verification, household identification, and you land onto what I'll show you in a minute is the platform. And we're calling for the moment this product, if you will, the Alice Marketplace, although I'm sure it'll be called something different by the time we go to market with it. And in that platform, people have access to services different from 211 in that if you call 211 right now or go online, you can find wonderful resources, but you have no idea if you're eligible. And then you need to track down those services in order to determine if you're eligible and go through multiple processes. And what we'll put on this platform are things that we know you're actually eligible for. You'll also have the opportunity to have discounted products and services through our business network. We'll have stronger community connections with our donors, and we'll have that prepaid card system that I spoke about. So programs and services, just as an example. You've gone through a confidential online income verification. You didn't take time off of work, so it gave you dignity. It was accessible. You are now going to enter into programs where you have choice and you can decide what fits your needs. And we'll have built a database of households that we can now communicate to, and they can communicate to us, more importantly, so that we, in an instant, we'll be able to know what the needs are, whether they're shifting, whether what we're doing is working or not. I think that data will be really critical to improving systems and services for Alice. So on the screen, I just have an example from the food section. If somebody clicked on the food section and they were in my United Way footprint. So this will be scaled across United Ways, across the country. And we will load the programs that are meant for our local region. So if you're in my footprint, Healthy Savings is one of those programs. So I no longer will need to have to go to multiple providers to have them register their clients and then try to track third party. Instead, they'll be able to register instantly online because we already know that they're eligible for that based on their income. And they'll, so they can get their income verified, they can sign up for Healthy Savings, and within about a half hour, they could be out to the grocery store saving money. The same thing would occur with our enrichment fund, where you would sign up automatically, we would approve it, and you've never left your home, and nobody knows that you're accessing services. The prepaid card, the one that we've been testing now with our COVID-19 response, we envision that everyone will have access to a card, and then depending on the needs or the programs in your footprint, that card will be used differently. So for example, our enrichment fund, we would load your card every time you were signing your child up for ballet lessons or for soccer club. If you lived in an area where a hurricane was coming, we could easily deliver money to support the wood that you need to board your home up with, or the hotel, or the gas, or the food that you might need to stock up on. COVID-19, our biggest challenge in launching a statewide fund was figuring out who was going to qualify people who were in need. And how do we do that? And if you had a pool of people, if it was 40% of your population was Alice, and you had a large portion of them on this platform already, imagine how quickly we would have been able to respond to the need that was emerging. And then the other thing is the giving fund I spoke about. We'll have the ability to put the money onto the card to pay for the bills that people put into their giving stories. Business engagement will be different because we will be working with both local, regional, and national business partners, where a business can go on and register. They can create a coupon, a digital coupon, and Alice can download that by going into the marketplace area on the platform and pick and choose the coupons that they might need. So it could be as simple as a local hairdresser or barber wanting to give out free haircuts on a Saturday, where you can push out information about that. It could be a dentist office. It could be a corporate partner. We have AXA XL featured here because they've offered to do stress management workshops for Alice. It could be pet products. We know that one of the things that we've learned from our focus groups is that many Alice households have pets, and pet food is very expensive. Can we get a discount with Petco, for example? So we'll be engaging businesses directly to support the population. And then finally, we'll be engaging individuals differently because they can also register, and we can immediately say, you just sent that family to the grocery store because somebody signed up for Healthy Savings. Or thank you, as I have on here, Debbie, you just sent another child in your town to ballet lessons. It really creates a better engagement experience, and it will help us raise more money for those programs that we're supporting. Now, COVID-19, I've been thinking a lot about what the world will look like, as I'm sure we all have been. We know that we're not going to go back to normal in any sense anytime soon. So some of the things that we can anticipate, we are going to see an increase in the Alice population nationally. We know that the economy is not going to come back full swing in the next few months, and that people are going to fall into that paycheck to paycheck category. And that these people who fall into that category now are going to be even less aware than those who are already in it about how to access help. And so we're going to need to educate people on what resources are out there. We're going to have increased need for touchless support. So things like Healthy Savings was a perfect fit. The digital card, we're sending money to individuals across the state. We're sending $200 digital cards that go into your phone wallet that you can use an Apple or Google Pay for at the store. So you literally touch nothing. I don't know if anybody's been using Apple Pay, but I started after we formed the COVID-19 fund, and I haven't touched a keypad since, quite honestly, because it's the best way to shop and not have to expose yourself or have a health risk. We know there's going to be an increased need for access to technology. And then we know that there's ability to communicate and deliver resources faster and more efficiently. And we're going to need to build up that pre-qualified database because there will be other crises that come along. And I think that's one of the most critical things. We are so slow to respond. And when people need food or need to pay a bill, they need it that day. And when it takes 4 to 6 weeks to deliver that aid because of all the systems that have to get working and all the wheels that have to start turning, we just know that people are suffering and we need to be more agile and able to pivot. The marketplace program that I'm working on has a launch. Hopefully by January, we'll do a pilot phase. And then by year 3, we anticipate having at least 500,000 people on the platform, over 100 United Ways and 3,500 business partners. And we've got a plan to do that. We've just launched our RFP for the technology, and that should be started in July, and it should take 4 to 6 months to build the actual platform. Just to highlight for a second who's leading this effort. So my Alice Advisory Board, we have about 20 people from our 3 regions that we serve. We'll start to expand that as we get other United Ways on board so that we're making sure to get a voice across the country. And then I have an Innovation and Technology Advisory Board right now because I'm not a technology person. And I rely on their expertise. And as United Way traditionally does, we use volunteers quite a bit so that we're not paying for the service. And I have a stellar group of folks who are helping us. And then our next steps are to build the technology. Again, the RFP is in process right now. I'm raising the money for the launch. We have already raised $1 million to invest in this, and I'm raising another $2 million. So I'm looking for investors and donors who really want to disrupt social services and find a new way and bring us and the partners along with it. We'll determine the pilot phase with the United Ways, and then we'll have a January launch. So that is what I've been doing with my free time. And I would love to hear from others, you know, and especially from the partners on the call, you know, their experience with using the digital platform and some of the programs that we've been bringing to scale.
Thank you so much, Kim. I know that a couple questions came in through the chat, so we can go with those first.
That'd be great.
Regarding Alice Saves, how does this compare with past experience in Connecticut with individual development accounts?
So we did a lot of research on individual development accounts, and we spoke with, I believe her name was Marie from the state, who's like the guru of IDAs. And we found that they were difficult to, you have to limit what people can spend their money on. And the success rate wasn't there. People weren't drawn to them as quickly. And we just didn't feel like, we just looked at the data, and the data wasn't there to support scaling that. And that's why we went out and found the matching savings program.
Linda, can you hear everything? Because you're making I don't know if Linda Coe is trying to say something.
You're muted, Linda.
You're on mute. I don't know if she can hear, but Linda, there's an unmute button on the top right probably that you might have to click. Are these programs operated throughout all of the United Ways in Connecticut or just United Way of Western Connecticut?
So Western Connecticut is the one that's doing Healthy Savings. The Alice Saves is statewide. We were able to get everybody to join in on that and get some funding for that to support it statewide. And then our COVID-19 response has been statewide and local. So the more we can leverage a common experience, the better. You know, as each United Way is a separate 501c3, and we have separate boards and separate focus on what the community needs. But the more we can do together, I think is a better approach for our residents, because we know that people live and work in multiple communities. So the Enrichment Fund is local, that's Western Connecticut. And the Giving Fund is operated by several United Ways, but that's really in partnership with Hearst Media.
Easy way to unmute yourself is just hold your space bar down. So if anybody's
Linda,
having
she was
trouble.
able to type it in. Is the program available to undocumented individuals?
Yeah, all our programs, we don't determine documentation. So everything that we do is open to any resident of the state, of the region that we're serving.
Okay,
Yep.
great.
And the nice thing is that, for example, the COVID-19 response, we know that our undocumented immigrant population is not getting served by a lot of the government support, right, for unemployment or for the stimulus checks that are coming out. They may not be able to receive that. So even more, it's needed to have that flexibility to give that to them, support them.
That's great.
And yes, and I just wanted, this is Anka from Building One Community. We partner with you guys, and we've been working on the wallet card of $200, and we've been looking for people that have the need and might not have received any other support through us and so on. So we've been working very closely with you on that and the health saving as well. So thank you so much for that support and that partnership.
Yeah, you're welcome.
Yes.
Kim, has this,
I just wanted to say thank you to Kim as well and the United Ways. And, you know, we've partnered with you and we're so grateful for that on the most recent COVID-19 funding. But all our clients have been utilizing your services for a long time. So I'm very familiar with Alice Saves, the Alice Advisory Board, and all the food, the Healthy Savings card. So we've received nothing but positive feedback from our clients on utilizing those services. So right now, obviously they're so needed, but even before this, you were already working with the populations that was the most vulnerable in the state. So we're grateful for that. And our clients are saying, we're so happy someone's listening to us, especially through the Alice Advisory Board. I think that's so important that they know someone is listening to them. So not just money, but also listening to them about what the needs are. So what you're doing going forward, what you mentioned about, you know, kind of paring it down to what's available people and knowing, you know, your target market is even better, because clients are very hesitant to move forward to reach out for things. So once they know it's for them, I think they'll be more inclined to go out. And as an organization that is kind of an intermediary between all of the resources in the community, that's what we do. We educate our clients about what's available to them. They're very intimidated to go out there. So it's very good to know that they will know this is exactly for them. So that's good to hear. So we do appreciate that. I had something else to say, but I definitely like what you're doing going forward. I see where you're going with it. So that's great. to see.
Thanks, Lana.
And the only thing with technology, I do have to mention that, so not all of them, as you know, are technologically advanced. So there's always that little glitch with a smaller population of them that haven't embraced the technology of Apple Pay and Google Pay and all of that, whatever the technologies are. So I'm learning it all myself too. So, you know, that's the only thing. Like, I love that you're moving towards the technology, and we have to be contactless, like you're saying. So they'll need to embrace that. So thank you. That's what I have to say.
Thanks, Lana. Yeah, and the technology has been, it's been really interesting to test this digital payment with this population so quickly. We stood this up within, I think, 10 to 14 days. We started delivering money to people, and not having done it before. And the technology, we're finding that it's definitely, there's definitely a segment that it's not for, right? So we are not trying to do this with seniors, for example. We explored that, and we just felt like it was going to be too difficult for them, or they didn't have the capacity at scale. We're also finding that people that are in poverty who have state phones and so they're not really in the ALICE category, that some of this technology is not working with that. They don't have data plans that support what they need to do. And then there's just an education. I mean, it was for me too, because I'm, 52, and I'm not the most up to date. I'm finding things out every day. There's, we're working with the foundation. We're about to work with the Parent Foundation to deliver support to their clients. And they're working with young people. Well, young people are using Google numbers, which I'd never heard of. I guess you can get a phone number from Google. And so does that work? And it does, but there's new things coming about every day. And this is not going to be the answer for everybody. And we're just going to do the best that we can, as focused as we can. And then there's going to be groups that we have to find other ways to reach. So thank you for that, Lana.
Jim, there's another question. Has this model been executed by other United Ways in other parts of the U.S.?
No, this is us starting. We're talking to other United Ways around the country. This is a consumer-facing product, so it's different from what a lot of other United Ways are doing and other organizations are doing, is really that case management behind the scenes, analyzing, if they got housing and you married that with counseling or food, or, that case management piece. This is really going to be a product that we hope the majority of households that live paycheck to paycheck will go to and embrace, because it benefits them immediately. And then long term, they get access to education, vocational training, that we can really build up the ability to ensure that they and their children don't remain ALICE. That's really the goal. But that there has to be an immediate hook and a reason. And so we think that marrying it with the business discounts will benefit both the businesses and the ALICE population, while we're educating them around the social service aspect and what might be available to them to improve their lives.
Sylvia Shepard is asking, will the platform be easily accessible on a mobile device?
Yes. It's a web platform, so we're not building it as an app right away. At least that's the thinking at the moment. We'll talk to the technology companies that reply to the RFP, but the reason for that is because a lot of ALICE households don't have high data plans. So we think that we'll reach more if we start on mobile web, and then we'll have an app at some point that will integrate with it, but it will be absolutely available on mobile devices.
Okay, great.
One thing I just wanted to mention, Kim, is this. First of all, congratulations. This is so exciting, this project, and we want to make more and more people aware of it, and all the great work you've done, with the individual programs kind of leading up to it. It's just really phenomenal. And the way you've engaged ALICE households on your advisory board to really listen to them and really kind of have them help to define kind of, the focuses. It's really phenomenal. I just wanted to mention, it's something because I know you've talked with one of our partners, Pat Gentile. We're doing this extensive effort right now on VITA, where we have a virtual platform and we're trying to proactively reach out to people who haven't filed tax returns and are eligible for stimulus payments or earned income tax refunds. And the idea there is that we are going to build up with CAUSE, who is the sponsor of it, a Salesforce database, essentially, of all the families that they deliver VITA services to, and would love to work together with you, collaboratively on how, we can, because a lot of these families are obviously ALICE and would really benefit as you kind of get up, as your new platform gets, up and running. And I know there's already plans to kind of create some text or links to some of the programs like Alice Saves, for example, as a part of filling out the taxes right now. So we're already starting to work together on that, but I see a huge opportunity going forward.
Yeah, thanks, Mark. I do too. I mean, that's the perfect example. Tax time comes, we push out to everybody on that platform. Here's what you do. It's VITA, My Free Taxes. Here are the products. And we have the ability to communicate and build that database. And I think that'll be critical. And link them back to the programs that are in their community. Everything will be zip code based. So when a consumer goes on to the platform, they'll see what's relevant to them in their footprint, in their geography. And so it might be online VITA in Connecticut, and Florida might have a different system, and they'll see what, if you're in Florida, you'll see that system.
Hi, this is Sylvia. I just wanted to jump in. I know that it's difficult to reach this ALICE population. A lot of people don't, they're not familiar with what's out there. They, as you've said over and over, they're just hesitant to acknowledge that they even need the help. Are you planning to have those discount coupons like pop up on people's phones? I mean, it's like, I know you want to target that population, but it just seems like if it could be almost like a universal where those discounts will pop up on, anybody's phone, and that could be a way to draw people in. So
yeah.
Okay, great. You want to talk a little bit about that?
So, sure. We're going to be looking at one, how to drive people to the platform. The platform only works if we have enough people on it and we have enough offerings for them. So we have to make sure that both come on at the same time. And so we're going to be looking for partners who will help to drive that interest from the ALICE population, some kind of offering for the first 1,000, 5,000 people that sign up, that kind of thing. And as far as the actual couponing, some of that will depend on the technology that gets built. And some of it will be simple, right? Like you want to go to your local barber, print this coupon and bring it in, and it shows that you're approved. But we're looking at what kind of partners we can bring on, like an Amazon, like AAA kind of model, where when you're a member, you get discounts. It's the same concept. We're not creating something that doesn't already exist in the world. We just want to make it better and for the right population. So we'll be looking at systems like that to put onto the platform and not have to recreate everything.
There's just a comment from Karen saying data collection is interesting. Important to know how many ALICE households with specific needs live in specific towns in Connecticut. This will be eye-opening, especially for suburban legislators.
Yeah, I think the data is going to be really great. And even the data we have from the statewide COVID response, we know where people are spending their money right now. We don't see individual, there's no privacy issues as far as we don't know what's in a basket. We don't know who went where, but we know that, and I don't have the numbers in front of me right now, but we're looking at it. But that food, who went to Amazon, who went to Walmart, who went to food stores, what were the habits that they spent? We see the prevalence of fast food because that's really cheap right now, and we can tell who's using that. We were able to survey people coming in, what were the highest needs, and then we can compare it to their actual behaviors. So I think, and just imagine if 40% of the population, even if we got half of that across the country, it would be incredible information, and it could influence policy at some point when we have scale.
Okay, are there any other questions or topics that people want to bring up? We have about 8 more minutes left on the clock, so we can entertain a couple more, but then we'll close it out. Is there anything else? No. Okay, Kim, thank you so very much.
Thank you.
To finally connect with you. I am sorry that it took so long, but we finally got together. So we really appreciate it. You're doing incredible work, and we wish you all the luck, and we're here to support you in any way that we can.
That's great. Thank you. I really appreciate the opportunity, and I'm so thrilled to see so many of you that I know and actually see your faces. So thank you very much. I appreciate it.
Yeah, it's a good team. Okay, be well. Thank you very much, guys.